and Andrew for that presentation. We'll move now to Yvonne Zurynski. Yvonne's going to be talking to us about a model of care, a case study in integrated care for children. Over to you, Yvonne.
Thanks very much, Leanne. I hope you can see my screen okay. All good? Fantastic. All right, so integrated care is well recognised as being an important part of adding value to the health system, and it's certainly been recognised by organisations such as the OECD, the WHO, the Commonwealth Fund and the King's Fund, and there are lots of different definitions of integrated care, but I quite like this one, the International Foundation for Integrated Care definition, which talks about the integrated care being holistic, co-produced, continuous, coordinated, equitable, sustainable care that's efficient, effective and of high value. And it contributes to sustainable development of care systems over time. So I think that's a really lovely comprehensive definition. Integrated care is recognised by global organisations, but it's also being recognised at more local levels. So the Australia's Long-Term National Health Plan certainly talks about integrated care as increasing value. And you heard George speaking about integrated care being one of the strategies to increase value in the health system from the New South Wales health point of view. In terms of integrated care projects that we have been involved with, there are several and there are more that are about to start, but I'll just tell you about a few. We've been looking at the Lifespan Suicide Prevention Program together with the Black Dog Institute and the Ramsay Foundation. And this is a multi-strategy approach that links health services, NGOs, community, first responders, schools and workplaces with health services. One of the things I want to pick up on for this one is something that Leanne said at the beginning, in that there's a lot of evidence for the effectiveness of some of the interventions used in this program. But what we're finding in the evaluation is that it didn't necessarily meet the needs of the local communities. So although you have evidence, it may not actually work in the local context. The other one we're looking at is Heart Connect. That's an integrated cardiology service that brings GPs and specialist cardiologists together. We're doing that together with the Sydney North Primary Care Network and MQ Health. And this provides rapid access to a cardiology clinic. So patients are seen within 48 hours. And there's also a phone advice line for GPs. So GPs can call the cardiologist and get some advice about what to do with a particular patient. There's another project, Strengthening Care for Children, led out of Melbourne by Harriet Hiscock, and that embeds paediatric specialists in general practices. But the two I really want to talk to you about are the ones that I've been involved with most. That's the Kids Guided Personalised Service, Kids GPS, and Rural Kids GPS. So we're about to scale and spread this model across the state, which is really exciting. Okay, so you may not realise that 19% of Australian children have at least one chronic condition that affects their quality of life. And although there are only 10% of children attending children's hospitals that have these chronic complex conditions, because they need very complex care and frequent care, they account for about 60% of the expenditure spent on these children within usually large metropolitan children's hospitals. This really isn't sustainable, and a lot of the care that they come to the paediatric hospitals could actually be delivered more locally. So we came up with this Kids Guided Personalised Service, pulling it together through co-design. We did lots of formative evaluation with the children, families, health professionals, and those in the health system. And you can see there's a long list of people who were involved in this. This is not work that you undertake with a small team. You actually need to work within the system and be embedded within it. I just want to make a point about formative evaluation and how important it is when you're trying to develop a solution for a particular problem. And often it's, you need to map the process, and you need to know not only what is needed, but how consumers and practitioners want it delivered. Formative evaluation also maps the context into which we might want to implement an intervention. And Andrew and John certainly talked about the need for that. Is the fit right? And if the fit isn't right, if you're trying to put a square peg into a round hole, something needs to change, either the peg or the hole. So adjustments to the intervention or to the context are needed. Most often it's adjustments to the intervention because it's very hard to change context. So from the formative evaluation, we found that children with medical complexity were mostly accessing care from, tertiary, quaternary children's hospitals, so high-cost settings. There was lack of coordination, which led to missed care, duplicated care, and inefficiency. Providers felt that routine care could be managed closer to home. Providers, both specialists and GPs, preferred working in a more joined-up model. And parents said they trusted the hospital more than the GP, so that really needed to change. And in fact, many families didn't actually have a regular GP. They were very reliant on hospital services. And parents in regional, rural and outer metropolitan centres would prefer care closer to home. You can see some quotes there from parents. So we came up with this model which squarely put the child and family in the centre. There was a dedicated care coordinator depicted here as a superhero, and that person really was key to the whole system. They were the single point of contact. Some of these families, some of these children need a large team looking after them. There might be 10 health professionals looking after them, and they're juggling, appointments with those 10 health professionals in different settings. So this person really brought everyone together. There was a parent support phone line established, so parents could call and get advice, especially around whether they needed to come to hospital or whether they could do something at home to help their child. Cross-sector partnerships were developed, so, with schools and social care. Telehealth consultations were also used, often hospital to hospital, so local hospital to the metropolitan hospital, but also with GPs and families. And the other key thing that really facilitated integrated care was shared care plans. And the shared care plan was shared with the family. So the family actually had a copy of that plan in their phone, and they could share it with whichever provider they were seeing. And of course, a lot of this was supported by networking and education and capacity building for both staff, clinicians, and the families. So the facilitators to actually implement this were, readiness of all stakeholders. There was support from all levels of management. There was obviously a funding allocation. It aligned with statewide policy on integrated care, and a skilled workforce was available. So they were certainly things that aligned. The other thing that made this be sustainable was the evaluation. So we developed an evaluation that was a continuous and living evaluation. Andrew talked about a living logic model. This was a living evaluation, so there were feedback loops, and the intervention was adjusted according to need. We used prems and proms, and we evaluated the program from the patient, provider, and the system point of view. You can read about some of that work in the papers there, but basically we found that the patients and families really loved the smartphone app and the shared care plan. They reported smoother journeys and less stress and less expense. They weren't travelling as much. School absences were prevented, ED presentations decreased by 40%, day-only admissions decreased by 42%, and about $2.4 million was averted in costs per annum for the Children's Hospital in Sydney. And this model has been sustained since 2017, but it hasn't been formally evaluated. That's something that, you know, we would very much love to do. But it comes to actually spreading and scaling this model now to rural children as well, to increase equity of access. So we just got a translational research grant from New South Wales Ministry for Health, and we are going to be implementing this model, or an adaptation of this model, for rural New South Wales local health districts. So you can see there we're probably covering about half of the state in terms of geography. It's a pragmatic implementation study, pre-post comparisons of health service usage, quality of life, PROMs, and we're looking at child, family and health professional outcomes, and also looking at the context-sensitive implementation evaluation, so looking at barriers and enablers. And in terms of PROMs, we actually advocated very hard with the ACI and New South Wales Health to get a paediatric PROM onto the HOPE platform that George talked about. We're yet to see it in action, but I believe it's coming, so that's fantastic. The other thing that we're leveraging is a paediatric care coordination collaborative, which is a statewide community of practice, and that will allow capacity building across the state in terms of integrated care. All right, so I'll end with a couple of quotes. Why is integrated care important? This is a specialist talking. What the Kids GPS have done for my patients is give them a structured way of managing their child's nasogastric tube if it were to accidentally fall out, which avoids them having to line up and spend a lot of time in ED. That's a very practical thing that he's noticed. And really, this parent from the Murrumbidgee Local Health District summed it up beautifully. We knew the plan, Sydney knew the plan, and my local teams knew the plan. So I felt like I could just turn up and hand them the plan and they would follow it. That's really what sums up integrated care. Make it easy for the patients and families, which is something that Leanne mentioned. All right, and that's all from me. Thank you.